Hey everyone. Today we have a really special guest, Dr. Tony Jimenez. He is the founder of Hope for Cancer, and they operate two clinics in Mexico. And we want to talk with him about like what you do, how it works, and just really get a good sense of all the everything that you offer at your clinic. So if you don't mind sharing a little bit more information about yourself and how your clinic operates, that would be awesome.
Thank you. Thank you, Toby, for having me. And it's always good to reach out to your tribe, right?
Yeah, absolutely. We love information.
Yes, thank you so much. So yes, my name is Dr. Tony Jimenez. I'm a medical doctor and a naturopathic doctor. And, we all have a story of why we're doing what we're doing, right? And for me, it was with my dad when he lived in the Houston, Texas area. He was diagnosed with prostate cancer. After some time, he called me and he didn't like what was happening with conventional medicine. So he says, son, you have to help me. And that was my momentum to do what I'm doing now, because I was a surgeon, and that was what I was focusing my career on. And so then in 2000, I opened Hope for Cancer Treatment Centers in Tijuana, Mexico, south of San Diego. Tijuana has been the mecca of integrative alternative medicine since the 1960s. So it was the place to go. And then in 2015, due to that, we couldn't we couldn't house all of our patients. We just didn't have enough space in Tijuana. In 2015, we opened the Cancun Treatment Center, where I am right now in beautiful Cancun. Yes.
That's really cool. So yeah, you guys operate two clinics, like one in Cancun, one in Tijuana. It sounds like the Cancun clinic is an outpatient and the Tijuana one is an inpatient. So, is there a difference with the type of patients that would go to each clinic, or is this just more of like a personal preference?
Yes, because our Tijuana Center is an inpatient facility. We're actually approved by the Baja California, that's the state where Tijuana is. The Baja California Hospital Association is a 21 inpatient bed facility. And most patients that come to Tijuana are a little bit more advanced. They might need 24/7 medical and nursing care. We're draining fluid. We're giving maybe them blood transfusions, everything that's needed. We're in the Cancun facility. It's outpatient. So these patients are more ambulatory. They can be in stage 3 or 4, of course, but they're more active. They're able to go back to the hotel at the end of the treatment day. And so that's the main difference. But the treatments in themselves are the same at both centers.
Okay. And, obviously you guys focus more on a holistic approach with the clinics. So what type of therapies are you really seeing? Are you really starting to use on patients? Is there like a combination that you're finding, is more helpful than others? Like what type of new therapies are you starting to include in your clinic?
Yeah, in preface to that question, Toby, I'd like to say that our philosophy is rooted in the 7 key principles to cancer therapy. And that's the topic of my first book, Hope for Cancer, 7 Principles to Remove Fear and Empower Your Healing Journey. And so all of our therapies are geared at non-toxic cancer therapies. And this is the question you're asking. That's one of the 7 key principles. And what we're known for around the world is using energy, using sound, and using light. This is called sono-photodynamic therapy. So we could target the deep tumors, superficial tumors, either non-invasively or even invasively. For example, a patient with esophagus cancer, we could go endoscopically with a fiber optic laser and target that tumor. So it's mildly invasive, very non-toxic, and very effective. So sono-photodynamic therapy is our marquee therapy. And we use a lot of hyperthermia, remembering that cancer cells, right, are heat sensitive. Unlike natural human cells, normal human cells are heat resistant. So when using hyperthermia, both locally and as well as systemically, and it's always, Toby, about the combination of therapies, right? Because we use multiple modalities. Cancer is very complex. Cancer is a smart process. So we have to work on those 7 key principles. The second key principle is the immune system. We have some very innovative bioimmunotherapies, unlike what's found in conventional medicine, with immunotherapies are toxic and, with very many severe side effects.
No, that's really, really cool. I was checking out your website as well, and I noticed you focus on the emotional and the spiritual aspect of healing. And I personally think that's so important because I think that's so overlooked in a lot of treatments because, if you look at the individual, what could potentially be causing some of these issues? Is it like emotional damage? Is it something else going on? And I think that's awesome. And, if you
Yes.
could expand on that a little bit, that would be great.
That's always, Toby, the subject that draws more attention by patients and people because it's that known unknown
Yeah.
situation, right? You think, yeah, that plays a role, but how does it play a role? So that's actually the seventh key principle in our seven key principle philosophy. And I don't know if I picked seven because that's a good number, but it should be number one, as you said, right? So we call it the behavioral, emotional, and spiritual therapy. That's the best
Yeah.
program. And I'm here in Cancun today. The room right in front of me is where our best doctor is there. She works on the emotional. So let me give you an example.
Okay.
Yesterday, I saw a patient. She has right breast cancer. She's a lawyer, very driven, very successful, and she has right breast cancer. And so she's done so much even prior to coming here naturally, most of it naturally. And she's like, why is this still here? And then I asked her, do you have any children? She says, no. And because remembering that the right side of the body, specifically the right breast, is the male side, right? And the left side is the mother-child.
Okay.
And so she had conflicts with her father. It led her not to have children. And so you look at these factors, and these are not psychological factors. That's the importance and the difference I want everyone to understand. When we're looking at the emotional aspects of cancer, we're looking at biological. That means it's the same for Susie as the same for Maria and Patricia. However, the trauma could have presented differently, but it made the same biological impact. And so the right side of the body, just remember this, is the male side. The left side is the mother-child side. So someone with colon cancer, it's what didn't they release? What didn't they let go of? Or what did they hold on to?
Yeah.
And so the tumor forms there. So the gist of this is the behavior, emotional, and spiritual therapy is key. And that when I ask the question, why did this patient not respond well? It always goes back, Toby, to that emotional, because some people just don't want to go there or they don't believe it. I tell patients, give it the benefit of the doubt. And we're very diligent. Here at our center, patients get 2-3 consults with our best practitioner, who's an MD as well. And when they transition to their home program after the 3-4 weeks at our center, we have another practitioner who does 3 more sessions with them. So we pay a lot of attention to this area of health and healing.
I think that's really great. I mean, just talking to a lot of people over the years who have certain chronic illnesses, you can definitely pick up on, instances of like, emotional issues, and I can see how that could be a major contributor to a lot of different diseases. And I do agree. I mean, we definitely have to, address it emotionally as well as physically to heal that patient. That's I always find that that's one of the most interesting aspects of disease is the emotional aspect, in my opinion, just because I think it's somewhat overlooked. No, that's really, really interesting. So how many doctors do you guys have working at your clinics right now?
Yeah, we have one thing that is very important is at both centers, we have a interventional radiologist, because we like to look at the films, the DVD, the CD that the patients bring with them with respect to the MRI, PET scan, CAT scan. It's always good to look at these scans again, because sometimes the written report is not the same as what is actually, the scan itself. So we have a radiologist at both centers. We also do ultrasound, high definition ultrasound to look at the neck, to look at the thyroid. There's so much thyroid disease now.
Yeah.
Even just nodules, not only, benign, but sometimes malignant thyroid disease. So we look at the thyroid, the breast, of course, the armpits, the axillae to look for any lymph nodes, all the abdominal and pelvic organs. So to answer your question, we have a radiologist at each center, And then we have about 25 doctors, medical doctors on staff at both facilities, a
Wow.
total of about maybe more. The number keeps on rising. We just hired 2 new doctors this
Nice.
week in Cancun. So it's about 25, and they're very loved. Our core principles are love, faith, hope, and generosity. And
That's
we
really cool.
promote that throughout all the centers. And it's so beautiful because, you know, no one can take your hope away. This is something I want to drive into our minds. Hope is something we get from God. And the only one that can take hope away is yourself, right? It's not the oncologist. It's not the person that told you, oh, you have 6 months to live. So grab onto that hope with faith over fear and be generous, learn how to receive, and good things happen.
Wow, that's a really good message. You did mention previously, you know, like a lot of thyroid issues. What do you feel like that's like, what do you potentially think could be the cause of that? I mean, I know a lot of like fluoride consumption may potentially cause some issues with that. I mean, is that something that you like, what's your theory or what's your thoughts on that, by the way?
Well, one of the things to know is that, remember, the thyroid is a master gland, right? It's an
Yeah,
endocrine gland. It's a master gland. So it does a lot to our metabolism. And so it's a sponge, literally, it's a sponge. So we see a lot of heavy metals, whether it's aluminum, mercury, cadmium, other heavy metals in the thyroid, and also glyphosate,
interesting.
what's in Roundup. So we do a testing called ART, Autonomic Response Testing, which is an advanced muscle testing taught by Dr. Dietrich Klinhart from
Yeah,
Germany. So with the ART, we're able to look at the cell level, the matrix, and then more superficial in the tissues. And so it's very important to do these tests to see, you know, where the heavy metals are, maybe also parasites and viruses and pathogens. But the thyroid is literally a sponge. And now with 5G and a lot of other toxins that are in our environment, the thyroid is one of the glands that is taking the blunt of the, the effects.
interesting. No, that's a fascinating, because I know a lot of people who have thyroid issues as well. And
Yeah.
it just seems like it's like the more people I run into, that seems to be such a common occurrence nowadays.
Yeah,
Um,
when we started and doing the ultrasounds back in 2000, very rarely did we see someone with thyroid nodules, and especially asymptomatic. And now, I kid you not, maybe 70% of our patients, including males, more females, but males as well, when we're just doing the ultrasound for an evaluation when they first arrive for whatever type of cancer, we see something going on in the thyroid as well.
wow. So it sounds like it's like a cumulative issue going on with environmental toxins, you
Mhm.
know, just some of the food that we eat, you know, heavy metal toxicity, even, 5G. So it sounds like there's a lot of different things contributing to it. Do you also find that, like, are you able to treat that with, like, iodine or anything like that? Do you guys focus on that by chance?
Well, yeah, it's always the 7 key principles. Look at the emotional components, detox, castor oil packs on the liver, on the thyroid,
Yeah.
getting rid of heavy metals, and promoting a good immune system ultimately. So yeah, there's many ways to treat depending on what we find in the ART and other testing.
Wow, that's really cool.
Yeah.
So, like, if you have a patient who obviously, finds hope for cancer, wants to, is becoming a patient, is there any requirements, like, for them to become a patient? Do they have to, like, what do you guys require of them, or if anything, to come to your clinic?
Yeah, so now we're finding that many patients are being referred either by their physician or healthcare practitioner back home, or a friend of a friend, or someone that's been here, or some patients find us through, summits like this. Toby, thank
Yeah.
you for having us, and or other online events. And so they reach out to us. They call our admissions center. Our admissions ask for records, and we have a doctor, an MD, in our admissions office who reviews the records and develops a treatment plan. So
Okay.
that's a treatment plan. The admissions team takes care of all the logistics, how they're their passports, and so it makes it really easy. They streamline it for the patients very easily. So typically, I would say 90% of the patients that come either to Tijuana or Cancun, they come with a companion, which could be a spouse, a friend, or a sibling. So it's really streamlined. So basically, go to our website, reach out to our admissions team, and they take it from there.
Okay, that's really cool. So like when they get there, from what it sounds like, they stay for about, like at least in Cancun, they stay for about 3 weeks. And is
Yes.
that the same for Tijuana, or is that slightly different? But like after 3 weeks, they go home. What do you do to prepare them, to go home? Do you coach them on like diet, certain lifestyle changes, or do you set up expectations for them when you send them off?
All of that, Toby, all of that and more. I believe that the first day that the patients are at the clinic, that's when discharge starts. The first
Okay.
day. So
Yeah.
that means we're preparing them from the very first day. We have a lot of education videos. I've done about 65 webinars during this pandemic phase. And so there's plenty of information, education. The doctor spent countless hours with the patients, and of course, my book, the Hope for Cancer book. Yeah, we're always available for the patients, so we're preparing them. By the time they are discharged, like you say, in 3 to 4 weeks, depending the length of stay. Most patients are here 3 weeks, some stay a little longer, but by the time they're discharged, they really know what to do at
That's
home
good.
with
That's
respect
good.
to nutrition, with respect to continuing the home program, because we don't send patients home with a box or a bag of supplements. They go home with a very robust home program. Sometimes it includes injection, like with a little insulin needle under the skin. These are some of our bioimmunotherapies. They take machines home that they do the sound therapy at home. So it's quite a robust program. These 3 weeks, it's a big aggressive push, sort of
Yeah.
like a boot camp. And when they
Nice.
get home, they continue that because, they're only with us for a certain amount of time. They're going to be more time at home. So yeah, the home program, as you say, Toby, it's so important for their outcome. And we have a home program support staff. In that office, there's 4 doctors. So you're seeing we have many doctors. These were
Yeah.
not even in the original 25 that I said. There's another 4 doctors in our home program support team. And they're calling the patients every week. Mr. Smith, how are you? Any questions? Do you have any challenges? Are you, withholding with all your therapies, doing all the therapies you should be doing? So there's a lot of good communication. It's not perfect, like nothing is, but
Yeah.
it's very well established, our home program support system for our patients once they get home.
No, that's great that you have that support network in place, because that is obviously, in my opinion, so crucial. When you go home, patients have questions, they need assistance. No, I think that's definitely, sounds like you really cover all the angles for your patients when they're at the clinic and also when they go home, which I think is incredibly important. I definitely wanted to ask, obviously, look, we're located in the United States. Cancer treatment in the United States is big business. It is incredibly expensive if a patient gets cancer, regardless if they have insurance or not. How do you guys compare? Most of the time, if a patient in the United States gets cancer, it could be a monetarily draining event on their life. I mean, they're going to go into tremendous debt regardless of their financial status. How do you guys compare? Like, what are your, like, obviously, I'm guessing it's more affordable. What are you, like, what's a good way to explain that to the patient?
Yeah, this is probably the toughest question you could ask me because I know very little about finances, even at home, right? I don't know what our mortgage is, but what I do know is that sometimes 1 chemotherapy or 2 chemotherapies will be about the same of what patients pay here for the 3 weeks plus the 3 months home program.
Wow.
So we have patients that some of them have to refinance their home to come. Others, it's like nothing to them. So we get all walks of life. Some patients who GoFundMe, but I believe that if it's in your heart and the Lord has driven you to come for Hope for Cancer, you will find a way. The Lord will provide. Things happen. I've heard so many stories throughout the year We had one patient that came from Africa, from a small country called Botswana, and it took him 4 days to get here. He had to literally, and I'm not kidding, he had to go on a canoe, a horse, and make it somewhere else and take a bus and then finally to the airport and, take 3 planes or 4 to get to us. So, when there's a will and God is leading you, you'll get here. So finances is important to all of us, of course. We live in this world. However, don't let that be your stumbling block to reach out to us, because you'll be surprised how so many patients that they said, this is just a miracle that I'm here. And others say, 2 weeks ago, I just found out about you, or my health practitioner told me about you, and here I am. So yeah, don't let the finances deter you, just if it's in your heart to do it, call our admissions team and they'll explain all the details of everything is black and white. There's no gray area here. We're very transparent. We've been doing this for nearly 22 years. We'll be 22 years this July, August, when we open our Tijuana center. So that's the best advice. Yeah.
No, I think that's a great explanation. Obviously it's going to vary based upon, what the patient is going through, but it sounds like, if you compare it to, the United States medical system, it's far superior in my opinion. No, that's really cool. Obviously, we do a little bit of ozone as well at PromoLife. It sounds like you guys also incorporate oxidative therapies in your clinic in Mexico. What are you like? Is this a common thing to add to cancer treatments? Like what are you seeing like the results as far as adding oxidative medicines to cancer?
Well, we do a lot of ozone, not a little bit at our centers, Toby. We
Good. That's what I wanted to hear.
Yeah.
That's excellent. Good.
Yeah, and I myself have a PromoLife device at home. So I just completed my first book on ozone therapy. We wrote it in Spanish, so I'm having it translated to English now. But ozone is a mainstay therapy. I've been doing ozone since 1988, and it forms an important part of our treatment philosophy. Actually, one of the 7 key principles, and I'll show my book so that the audience could get a visual, but this is Hope for Cancer, 7 Principles to Remove Fear and Empower Your Healing Journey. And one of the 7 key principles is oxygenation. So bio-oxidative therapies are a must. They're a must. We know, some of us call ozone the super oxygen molecule, right?
It is.
And
it is.
we know that oxygen is vital for adequate integrity and function of every cell, all tissues and all organs in our body. So we use ozone on a daily basis, rectally after the coffee enema, patients get ozone. And then we also do ultraviolet blood irradiation, UVBI, where we take blood out, we put it in a bottle, we put ozone in the bottle, and then we pass it through a UV light to clear out, more pathogens and so forth. And then we do ozone in saline solution as well. So we do that intravenously in saline solution. And when the patients go home, Toby, we oftentimes, very often, we ask them to get an ozone unit to continue ozone at home. So the diverse ways to use ozone. Ozone has, diverse mechanisms of action. We know that the blood is a small universe containing many cells and substances. So when you introduce ozone in any modality and it gets to the bloodstream, you're setting off multiple biological and therapeutic effects, on the immune system, anti-inflammatory, antimicrobial, the list just goes on, and for degenerative diseases. So I'm a big fan of ozone, and yeah, we do a lot of it.
That's really cool. I mean, I've just been around ozone for so long, and we get to hear a lot of great stories regarding it. And I honestly, I think it's something very easy to do at home as well. I mean, just with like rectal insufflations, it's not overly complicated. You can easily learn how to do it. I feel like there definitely can be a stumbling block for some people just with that whole idea or mindset. But I think once they get past it, the first couple of times they're like, wow, this was nothing. This is way easier than I expected it to be. At least that's how it was for me. You know, it's
Absolutely, Toby. If I could interrupt, Toby,
yeah,
we get these patients from Arkansas, the Cowboys and New Mexico and Texas, and nothing is going down that way, right? Through the
yeah,
rectum.
seriously.
And then then after a week or so, they said, "Can we get double today?" Because they begin to feel better. And rectal ozone is so easy to administer. You feel better. Now with how the world is with these pathogens that are around and all this, ozone is a must. I also like, Toby, the ear insufflations. That's
Yeah.
one of my favorites is the ear insufflation. As you said, all this is very easily done. And at Hope for Cancer, because the patients are doing it here, continuing at home is very easy for them.
So it sounds like that's just not to, ozone is one key component. Sound and light is another key component. You try to send them home. So when they go to your clinic, they obviously learn how to do a lot of these, they see the results, they learn how to do it, and then they can take it home with them and continue on their journey. Because I do feel like that's so important because, you go to these clinics, you get the treatment that you need, but you have to continue this change and these treatments when you go home. And I think that's so overlooked, especially in mainstream medicine. Like they go, these patients go for their chemotherapy, they go home and they wait. And this is such a nice tool because I feel like they can continuously be advancing themselves, throughout this journey. And I love it, honestly. I feel like it really, yes, it's a lot of work, but I feel like it really helps them through their journey and gives them even more hope.
Absolutely, especially when you compare mainstream medicine to a facility like Hope for Cancer, where there's hugs, people are laughing. We start every morning with praise and worship in a little theater
It's
room,
awesome.
and they're encouraged and they see that they're feeling better. So they're compliant. Most of our patients, not everyone, I must admit, but the great majority are compliant, and they will see the benefits when they're here. We had a patient that I saw a couple of days ago. I'm here at our Cancun treatment center at the moment. The ocean is behind me and the lagoon is in front of me. But this patient by the name of Alan from the US, from Virginia, he came here with bladder cancer. His bladder was thickened 5 millimeter, and he had had some treatment at home. And in 3 weeks, he was totally clear.
Wow.
Mind you, that doesn't happen all the time, but it did happen with Alan. If it happened with one person, it could happen with others, and it does, right?
Yeah.
So that's how quick some of these results can be. But, with Alan, he's really vested, spiritually, emotionally, doing his therapy, not in fear, positive attitude, heart, a lot of love, and it shows his results in 3 weeks. He left NED, no evidence of disease.
That's amazing. No, that's like I said previously, I love the emotional aspect, the positivity. I feel like in this world we live in, it's so everywhere we turn, negativity. But focusing on the positive, being a happy individual, we can really, excel past that negativity and be a lot healthier in the long run. Obviously the past few years have been incredibly strange. How did the pandemic affect like how you guys operate? Like I know being in Mexico is a little different compared to the United States, but like did you see like patients more worried about coming? How did you deal with the whole situation? If you don't mind me asking.
Yeah, you did say Mexico is different, and it is, because here the vaccinations are not mandatory or
Yeah.
even required. Now, for example, it's 100% free. There's no mask, no vaccinations. You don't require a COVID test to come into Mexico, so that you've never had. So fortunately, our Tijuana center never closed, Toby, never closed. It was open the whole time. Of course, the patients from Canada, from Europe, and from Australia couldn't come because they couldn't leave their country. They were in lockdown. But we did continue to see the US patients. They were able to come back. At that time, when they go back to the US, they had to do a COVID test, but it was negative, no problem. And the Cancun clinic, we did close for 3 months. I'm sorry, we did close for 3 months back in 2020 and beginning of 2021 because the hotels closed. So
yeah, I get it.
The hotels closed, so they didn't have a place to stay. But we've done well because a lot of our therapies, therapies, including and mostly
Ozone.
ozone. You know, it's a key therapy for this. So we've done well with our staff. I've offered from the beginning, I offered our staff at no cost to get ozone insufflation, IV vitamin C. And so we made our therapies available even to our staff. And some had to stay home for a few days, but there was no, you know, no major effects, no serious conditions with any of our staff, and patients have done well. So it's for us, fortunately, it's been good. And now more recently, in the last couple months, we have now currently a patient from Ireland here. That was another country that was tough to get out of. We have a patient from Ireland, Europe, Australia, Canada, the US. So it's pretty much open now again.
Well, I'm glad it didn't, you know, truly affect you guys like it did with other countries. I mean, you know, we're here in Arkansas. We didn't really ever officially lock down it. You know, it wasn't a substantial change here as well. Obviously, you know, going to the hospital is completely different, but it's really good to hear that especially your Tijuana clinic remained open. That's a shining light, you know, compared to what happened elsewhere around the world. So that's really, really cool.
And what was funny, Toby, is that the US required a COVID negative test to fly back into the US.
Yeah.
But since Tijuana is at the border with San Diego, the most crossed border in the world, 1 million people cross that border every day. And you could drive across without a COVID test. So it didn't really make sense. You know, you have to take one to fly over, but to drive across where there's millions of people crossing every week, it was never required. So
you may have had people fly to like San Diego or Los Angeles and just drive across the border, I'm guessing. So.
Well, that's how patients get to us. They fly to San Diego, and then our driver picks them up in San Diego and drives them across to Tijuana. It's about a 35-minute drive from the San Diego airport to the Tijuana treatment center. And we take care of all that. We take care of the patients from A to Z. Of course, when they're discharged, our driver takes them back to the San Diego airport, and from there. In Cancun, obviously, you know, there's over 100 international flights that land in Cancun every day. So yeah, it's easy to get here.
That's great. It sounds like you take the worry out of travel and you try to make it as simple as possible. And I feel like that's you know, for somebody dealing with a chronic illness, you know, limiting their stress, I can see how that's really, really helpful for that individual. And I love that you guys do that. That's really, really cool.
Yes.
I also wanted to ask, you know, one of the questions that I would love to, you know, just getting your opinion from. So obviously, you know, I'm guessing, you know, cancer it's probably more prevalent now than it ever was in the past. We're seeing more cancer cases. What, you know, obviously you've been doing this for 22 years. What are you finding as far as more of like a prophylactic that you can maybe teach people or tell people to help prevent cancer? I mean, I know that's a really tough question to ask, but you know, if anybody knows anything, it's probably you. So from a prophylactic standpoint, what are you finding that may be helpful for individuals?
Toby, a very, very, very important question you asked, because we know that now 1 in every 2 men will have cancer sometime in their lifetime in the US, and most industrialized nations, 1 in every 3 females will. And it's estimated by the certain organizations in the US that by 2030, which is not far away, everyone in the US will have cancer sometime in their lifetime. So we really have to be proactive. We have to take matters into our own hands. And you use the word preventive. That's good. Yeah, let's use that word. Why not? Because now in medicine, it's all about treatment. Well, what about prevention? Prevention is the key, right? And so let's do everything we can to decrease that incidence of cancer that's only increasing. And I believe it's increasing more now since these viral infections are out there. And I begin to notice that already, and other colleagues of mine in Europe and Portugal, even in the US, are reporting to me, and I have seen it here with patients that were in no evidence of disease or were in stable disease. And then after they got the, you know, dealings with this virus that's been going around the world for a couple of years, it's changed. It's changed the trajectory of the stability of their cancer. But to answer your question, it's rooted here, Toby. It's rooted in the 7 key principles to cancer therapy, because these 7 principles are not only for treatment, but they're also for decreasing the incidence of cancer. And we could use the word, why not? Let's use the word prevention, right?
Yeah,
And
absolutely.
so, yeah, when I thought about it years ago, I said, okay, one of these principles is non-toxic cancer therapy. Maybe you and I don't need to do that because we don't have cancer. But then in the last few years, I've gotten a little wiser and smarter. And I said, no, this principle should be also for all of us because we're all forming cancer cells every day. Our risk is higher. As you said, it's increasing. When I started this 22 years ago in integrative oncology, our median age of patients with cancer were about 60 to 65, specifically breast cancer. Now we have patients here at the center today that are in their 30s with breast cancer. And we're seeing that more often where before a lot of the German studies show that it takes 15 to 20 years for cancer to show up and to be palpable and found on the scan. I believe now it could take 5 years, right? Because of all the toxicity and everything that's happening. So let's adhere to these 7 key principles of cancer therapy. And all of us should be doing non-toxic cancer therapies as well, in addition to the immune system, oxygenation with ozone, the gut microbiome, the emotional, nutrition is a big part of all this, and detoxification. We have to live a life of detox because we're being bombarded every second of every day with toxins. So
I agree. Yeah, I agree.
Yeah, so that's a simple answer to your brilliant question.
So basically just detoxification, eat healthier, probably, exercise, focus on nutrition. I just think about I saw an article not too long ago about how much plastic we unknowingly consume just in daily life. Like, I think they're claiming up to a credit card's worth of plastic a week. Think of all the phthalates that you're getting in your body. I mean, just you have to sweat, you have to detoxify, to get that stuff out. So good.
So when you drink water, use a bottle.
Use a bottle
to drink your water, not plastic. Good point.
I don't think people realize how much plastic is actually consumed, just with the food. I mean, I would assume there's probably plastic pieces that are accidentally consumed that get in through production. But no, I really appreciate all the information in regards to the prophylactic, and people do need to take, if we want to not get cancer. I mean, obviously it could be inevitable for some people, but if we don't want to get cancer in our 30s and our 40s, I mean, we don't want to ever get cancer, but we got to do stuff now while we're younger to prevent that from happening long term. I think that's so crucial for a lot of people. And a lot of people like my age, they think they're invincible, and like in your 20s, you're like, oh, nothing's going to happen to me. I feel amazing. But that's where it starts. Like, I always tell people, like, hey, you feel great. Start now, because you're going to feel better longer and later in your life. And then you're going to be more productive. You're going to have more energy. You're going to be able to do better and greater things. So why not start earlier? And I think it's just a mindset. People just, some people just don't want to put the time in, but I think if they do, they're going to be wildly rewarded for what they've done.
Right. And when you say inevitable, it can be, but it doesn't have to be for the reasons that you mentioned, right? It's inevitable if we're not proactive and we don't take care of the things we need to take care of, because only 2.5 to 5% of all cancers are genetic. So please don't buy that if my dad had it or my sister had it or my uncle, I'm doomed. That's absolutely not true.
That's a really good stat.
It's the expression of those genes, right? The epigenetics. So it can be inevitable if you don't take matters into your own hands, but you can. And you're here watching these summits and educating yourself. So get an ozone machine, use ozone. I could tell you from many, many years of experience, it's a key oxygenation biooxidative therapy, and it's a key therapy to promote health, to promote better aging, and to decrease the risk of degenerative disease and heart disease, which are the 2 other big killers in the world.
Yeah, that's you're right. I mean, just so many people with heart disease, degenerative diseases nowadays. I feel like we're constantly being bombarded with, cancer, all these other diseases, and we really do have to be aware, and how do we treat that, through nutrition, diet, exercise, alternative therapies. And if we, like we said previously, if we start while we're younger, we're going to be way ahead of the game. We're going to be in a much better place down the road. So I think really sounds like the key is, don't wait till it's too late. Start early, be healthy, do what you can do. Obviously certain genetics do play a role, but it sounds like those can be overcome based upon, different things that we can do, for therapeutic and different types of therapies we can do.
That's right.
Well, this has been, really good. So if a patient wants to, reach out to Hope for Cancer, obviously, if they're referred, they can go to the website. It sounds like you have a link on the website where you can get like a free treatment plan. Is that correct? Like they can talk to you about what would be entailed. Can you go over a little bit more in detail as far as how that works?
Yeah, the patients or companions or doctors, practitioners, anyone can go to our website, www.hope4cancer.com, hope4cancer.com, where you could get you all can get a free consult by our admissions counselor and or our physician on staff. Have your records prepared, preferably. Your records belong to you. So if the hospital, your doctor doesn't want to give you your records, no, they're your property. So sign a medical release, get your records, everything from your biopsy, if you've had one, or your scans, your labs, the medical notes, and then send that to us. We'll review them carefully. We'll talk to you at no charge and prepare a treatment plan. So the treatment plan will go from A to Z to allow you to understand in writing in black and blue, or there's some color on that treatment plan, but in black and white, what our goal is for you and what your expectations should be, and what therapies and procedures and treatments will be for you. And then when you come to the Hope for Cancer Center, either in Tijuana or Cancun, you'll have an assigned doctor. That doctor will be your doctor managing or taking care of you during your stay at the center. It is a group effort because you also see our nutritionist, you also see our functional medicine doctor, you also see our best practitioner to work on the emotional and spiritual therapy. So it's a group effort. I come to the centers every 4 to 6 weeks, and we brainstorm, and I'm in touch always as founder and chief medical officer of Hope for Cancer.
Well, that sounds like you make it really easy to, become a patient, to get to the clinic, and to receive the education and the treatment to be successful. And I think that's obviously what's lacking in today's world. We really appreciate, clinics like yours that are available for people to go to, for people all over the world. And it really, I think it shines a light on, that there is hope out there for people, who have these these cancers, and who can, access, alternative treatment. So, we're very grateful for people like you to be out there and to offer these services. And, we appreciate everything you do. Is there anything you'd like to add, before we go? I know we've covered a lot about how the clinic operates, what type of treatments you offer, and obviously how to hopefully prevent, how to prevent things from happening down the road. Is there anything you'd like to mention before we go, Dr. Tony?
Yeah, before we go, I have a patient waiting that's from New Jersey, and she had triple negative breast cancer. She's in her early 40s, and she came to us from New Jersey 3+ years ago. Triple negative breast cancer is one of the difficult cancers because we don't know what it feeds on. It's negative to estrogen, it's negative to progesterone, and it's negative to HER2. So it's like having a car and you don't know what it runs on. Does it run on diesel or gas or air or electricity, right? So she's doing excellent. She's no evidence of disease. We did, in her case, do a combination therapy with her. We did some conventional therapies, a little modified, and the bulk of it was the integrative alternative holistic therapy. So she's doing well. I'm really happy to see her. I'll see her after this is done. Awesome. But the message for me to tell that story is that never believe that you cannot heal. There is always hope. And also, the mind is so important. A negative thought can kill you faster than a bad germ. And so remember that cancer is not a death word. People say cancer is not a death sentence, but it's not even, cancer is a word, it's not a sentence. Cancer is not a death word. So you need to realize that. And when you're change that emotional, mental paradigm, then great things happen. And remember, your spirit is never sick, because that's the spirit of God. What is ill is the body, the soul, and the mind. And so when we tap into the spirit and we make these decisions and we follow the 7 key principles, great things happen. And just like the patient that I'm going to see now, when she was giving a poor prognosis, and 3+ years later, she's totally fine.
Wow.
So thank you for having me, Toby.
Oh, hey, this was such a pleasure, and such an honor, honestly, because just getting the chance to hear your story, and just having the ability to understand how the whole process works, and just getting this information out to people so they can be aware of what else is out there, so they can understand that there is alternatives to what they're dealing with. And so like I said previously, we commend what you guys are doing, and we hope this continues and this grows even more for you guys. Or we want you guys to be incredibly successful with treating your patients, and we're so happy that people are able to find you.
Amen. Thank you so much.
Thank you so much. Okay. Take care. Okay.
Take care. Bye-bye.